one of your slides indicated that private insurance plans generally don't pay for these travel vaccines, but as I understand it, under the Affordable Care Act, preventive services, including vaccinations, are now supposed to be included, and I'm not aware that travel vaccines are excluded from that, and I'm wondering also the Medicaid population as well. So can you clarify that?
I'm actually not able to clarify that specifically today. Actually, as far as coverage, where this is involving travel by the insured, by the employer, it is generally covered. I'm going to have to clarify regarding the Affordable Care Act whether this is also covered under that rule.
The reason I bring it up is it clearly has cost implications for third-party payers and government agencies if, in fact, they have to cover it. And we're preventing 1 or 2 cases a year, it looks like, from your data.
Yeah, Ann or Kristen may want to comment on the Affordable Care Act, but I think the vaccines in there are vaccines that are in the recommended tables, the childhood and adult immunization tables, and this will not be in there.
Typically, JE is not reimbursed by insurances. It's not inexpensive. It's rather expensive. But companies will pay if they're sending somebody to those areas for work-related, but insurance typically does not pay for it.
We did learn that as far as the Affordable Care Act, that covers routinely recommended childhood vaccinations, not travel vaccinations. And secondly, I just had some personal experience with this because I just put my 15-year-old daughter on a plane to Nepal, where she is now. So I investigated this in depth, including talking with Dr. Fisher, and indeed discovered the serious costs about $500. Private insurance doesn't pay for it. My daughter belongs to a large pediatric practice in Atlanta who doesn't even offer the vaccine. I got in touch with a travel clinic to follow up. But maybe some of the people like Dr. Grog and Dr. Gershman know, is it really likely that a general practicing pediatrician will be called upon to give this vaccine and therefore interpret the recommendation, or is the child more likely to be going to a specialized travel medicine clinic who really knows how to interpret?
Yeah, typically they would go to a travel medicine clinic because if they need Japanese encephalitis, they're probably going to need other things such as yellow fever, which has to be a CDC certified clinic.